These women in their spotless white clothes stand out among the Pakistani flood victims who have been living with just the clothes on their back, sometimes for weeks. The women are collecting data for the government on the 40 to 50 pregnant women whose families now live along the main roadway between the capital Islamabad and Peshawar. While the skies may clear over Pakistan, the fear remains that farmland such as this one outside of Peshawar will remain flooded because of poor drainage, and this could be a big problem for the victims who live here.
The number of patients has 60 to 80%.
The number of patients has increased by 60 to 80%. People come 24 hours a day. Most are coming with miscarriages and some are going into labor early. Both maternal and prenatal mortality rates have increased.
At this camp outside Peshawar, healthcare worker Gul Naz says doctors, especially female doctors, are in short supply.
We need at least one female doctor who could look into the problems of these pregnant women. More collection of data is not what is needed.
Her colleague Arshad Begum says her job is made worse when she sees the survivors' desperation.
They ask us to check them, and they ask us to give them medicines, but we don't have that. We can only console them.
Another complication is the region's conservative attitude. Most of the men of the roughly 500 families living along the roadway have sent their women to live among themselves in their destroyed homes.
One of our colleagues is stuck here with the men to convince them to let us help their women. We have to some extent convinced them. But the problem is, even we can't stay at this camp because some of the men make our jobs difficult by harassing us.
The floods that began almost 1 month ago have killed some 1,600 people and affected about 20 million others. Senior Pakistani officials say the instances of waterborne diseases such as diarrhea have increased in the weeks since the initial disaster and have targeted the most vulnerable, including women, children, and the elderly. Sean Maroney, VOA News, Charsada, Pakistan.